Hi, I'm Eve Feinberg, and I'm a reproductive endocrinologist and infertility specialist at Northwestern Fertility and Reproductive Medicine, and I'm an associate professor of obstetrics and gynecology at Northwestern University Feinberg School of Medicine.
And I'm Jackie Hairston. I'm one of the fourth year OBGYN residents at Northwestern University.
So today we're going to give you a little bit of the backstory behind our manuscript on compassionate embryo transfer, physician practices, and perspectives. Jackie, do you want to tell the readership a little bit about the backstory on how this research project came into fruition?
Yeah, so towards the end of my first year, I just happened to be in clinic with Dr. Feinberg. We were seeing infertility consultation, IVF consultation, and we were going through the embryo disposition options with the patient, including, donation to research, giving to another couple, or discarding. The patient specifically asked about potentially giving to a specific family member. And when that wasn't an option, she said, "What else could I potentially do?" And Dr. Feinberg had actually mentioned the option of having the embryos placed into her body at a time where she couldn't get pregnant as an alternative for those embryos, a respectful alternative. And that patient responded to it. But after that encounter, I said, "Is this really an option?" So on a GYN24 call, I ended up doing a literature review and discovered that there are some references to compassionate transfer, mostly from the patient perspective, but there is actually no data looking at physicians offering this option to patients in the REI literature.
So you were curious, and again, a very rock star resident. So Jackie was curious about this. She did a literature search, and then next thing I know, we had a questionnaire that she devised and submitted this for IRB approval, went through the approved exemption process because the information was going to be de-identified. And the survey was sent through the SREI research mechanism, which basically means you submit to SREI, it gets approved through the research committee, and then distributed to the membership of SREI. And what happened when we got the data back?
So our response rate wasn't as high as we would have liked, or what is traditional for most journals, but I thought that any information or any data on this practice was useful because there was no data on it and there were no guidelines for it. So what I found most entertaining was actually our comments section, but before that, just the variety in practices, the placement of the embryos in terms of vagina versus in the uterus or cervix. I mean, it was divided about a quarter each, as well as the timing in the cycle as well, or whether people were on birth control, I thought was really interesting. And I thought in terms of, the financial situation in the healthcare world, the idea that people were either charging $0 for something that was requiring medical time, provider time, or ranging up to the amount of an actual IVF transfer. And of course, I think the most exciting thing was the number of people who reported pregnancies as a result, although we can't conclude that it was actually causality, but 3 pregnancies that people were willing to report after this practice.
Yeah, I found that most surprising. And I was actually surprised that more physicians don't offer compassionate transfer or transfer for non-reproductive purposes, which I think is actually probably the better medical name to describe this. But I think where I was really surprised was just the wide variety of comments that came about from it, which then led us to communication with the ethics committee as to whether or not the ethics committee thinks that non-reproductive transfer is ethically feasible or ethically permissible. And interestingly, the ethics committee then developed a document through their process and came out this past year with a full-on committee opinion regarding compassionate transfer, and that it's ethically permissible, and really walks through the different ethical principles of autonomy and reproductive justice, and talks about the utilization of healthcare resources for this procedure. And so, what can you summarize to the readers about our work?
Yeah, so I think this is something that REI providers are certainly, and REI physicians are certainly aware of. Whether they offer it regularly or not is very much dependent. I do think that based on our responses, there's interest and guidelines on this practice and whether there should be a specific location that we should be placing these embryos. The number of embryos that should be transferred during this non-reproductive transfer is also of interest, and how you navigate a patient through this.
Excellent. Thank you. Thanks for taking the time to listen to our piece on compassionate transfer.
Thank you.